Now, Mia, what's really concerning about this variant?
So there are a number of things that are concerning. The biggest thing is that it's got so many mutations, more mutations than any other variant we've seen. Now, some of these mutations are new and some of them are mutations that also appear on other variants. Now, the ones our scientists have looked at that they know are strongly linked to making the variant more transmissible, so it would be easier to get the virus. And there are also some of the mutations linked to immune escape. In other words, making our natural defenses and also the antibodies or immunity we build up as a result of vaccines less effective. We don't know for sure if it would do that yet, but there are strong indications that we should be concerned about it.
And how new is it, do you think? Has it already had a chance to spread significantly in South Africa?
So in South Africa, it was detected on Tuesday this week, on the 23rd of November, and it started with localized outbreaks. We thought it was just localized outbreaks, or our scientists thought, initially specifically in Tshwane, which is the capital city, also known as Pretoria in South Africa. And those cases started to increase rapidly. But when we then started to sequence the genomes of the viruses, we discovered that it was a new variant and saw that it also started to spread to other places nearby in Pretoria or Tshwane, specifically Johannesburg as well. And that variant has now been picked up in all provinces in South Africa. So it's definitely rapidly spreading.
And it really is perhaps what we don't know about this variant that's causing concern. We don't know if our current vaccines offer protection against it.
So you're right, we don't know. Our scientists started here in South Africa on Tuesday to do laboratory tests to see how our antibodies would react against this new variant. One of the concerns is that if you look at variants of, that we've had up until now, when the variant reduced the efficacy of vaccines, it was very rarely reducing the efficacy against falling seriously ill. It was mostly against the ability to get infected. So it made the vaccines less effective to protect us against getting infected. But with this new variant, it looks like, we don't know for sure yet, but there's some indication that it might also have an effect on other parts of the immune system. In other words, not just antibodies, but also something called T cells in our immune systems. And those T cells specifically protect us against falling seriously ill with COVID. So we are monitoring very strictly and strongly in South Africa currently hospital cases that are arriving because of COVID to see if the disease that the variant causes is any more severe, or whether we are in our immune systems or as a result of vaccination less protected against falling severely ill with COVID.
And Mia, it does bring back memories of when the fast-spreading Delta started to emerge. What have we learnt since to better manage outbreaks of COVID-19?
So we know that the two things that we have to protect us against COVID is vaccination and is non-pharmaceutical measures. We've got nothing else to use. So in South Africa, if we look at how those measures have been implemented, we are vaccinating, but our vaccination rate is low. Only about 35% of adults in South Africa have been fully vaccinated. So that creates an opportunity for variants, although I have to point out that it is not to say because our scientists detected it that this variant originated in South Africa. We've got a very, very good network of genomic surveillance, which is the things that you use to figure out if there is a new variant. So with vaccination, we really need to speed up our vaccination campaign. The other things that are being looked at South Africa over the weekend, on Sunday, our president will be meeting with our National Coronavirus Council to discuss whether we need to have stricter lockdown regulations. We're in a very low level of lockdown at the moment. One of the things that would be likely to be implemented quite rapidly would be restrictions on indoor gatherings, because we know that's how the virus spreads very rapidly. But we don't know what other restrictions restrictions would be implemented. And it's a very bad time for South Africa because we are moving into our annual summer holiday of December. So people have made plans to travel, and if there would be travel restrictions, it would have a significant impact on the plans that people have during the holidays.
Well, the UK is already banning flights from South Africa and other African nations. Japan has tightened restrictions. How is this impacting South Africans and how South Africans feel about that?
So it has a huge impact. As you could imagine, these restrictions happened overnight, and we have just come out of a third wave in South Africa because of the Delta variant. And when we came out of that, during that wave, as we came out of it and we started with vaccination, we were taken off the red list in the UK, for instance. We were on that for a long time. And being on the red list meant that you couldn't just travel to the UK. You had to quarantine when you got there, and you had to quarantine in government-approved facilities, which is a very expensive thing. It's about £2,000 to do that in the UK. Now, in South Africa, many parents have got children working in the UK and also in Australia, actually. And they planned for the summer holidays to finally, now that we're off the red list, to get vaccinated and to go to visit their grandchildren or their children. And they now have booked tickets and can't do that because overnight these rules changed.
It really is disappointing for many, I can imagine, but COVID really doesn't have a right time, does it? Thank you so much, Mia, for joining us. Really appreciate it.